Okay, so we're going to take Dustin's blood pressure. The reason we take blood pressure is to make sure that there are no pre-existing conditions, including hypertension, hypotension, to make sure that there are no emergencies that happen during the dental exam. First, we're going to make sure that the cuff is the right size. Looks like that's good. And we're going to make sure that this is all clean. I'm going to wash my hands with antimicrobial soap and make sure that the patient is not crossing his legs. Then we're going to, we have to find the systolic level first before taking blood pressure. So I'm just going to make sure that Dustin is seated comfortably, that his arm is flexed and outright. And I'm going to expose his arm here. I'm going to place the cuff about 1 inch above the brachial artery. Let's see. Okay, so first I'm going to place my 2 fingers on his radial artery and feel his pulse so that we can find his systolic level. When I can't feel the pulse anymore, that is his systolic. Oh, I have to tighten the valve. Hold on, there's something wrong. There we go. So I'm going to let the valve go. So his was 120. So I'm going to add 30 on top of that. So when I actually take his blood pressure, I'm going to pump it up to 150. When I take his blood pressure, I'm going to pump it up to 150. And I'm going to put my stethoscope on his brachial artery. The first sound that I hear is his systolic. And the last sound I hear is his diastolic. And I want to wait at least 30 seconds after that before taking the blood pressure. The stethoscope, these need to go towards your nose. Make sure the valve is tight. And I'm going to pump it up to 150. Okay, so your blood pressure was 130/90, which is good. So we're going to take this off. Afterwards, we would want to clean this for the next patient. If his blood pressure was abnormally high, then we would then take it again after waiting a few minutes, and then if it's still really high, then we would have the CI take it. The CI would be able to tell if it's too high for them to be seen at the clinic. If it's over 160, over 100, then we would need to dismiss them from the clinic. If the diastolic is over 120, then we would need them to go to the emergency room.